Hello all. On behalf of York Hospital, welcome to today's Zoom webinar. Today, our panel of experts representing public health and emergency care, pediatrics in both ambulatory and acute care, will talk about how York Hospital can help you and your family fight the flu this season. Today's webinar will be presented in 3 parts, delivered by members of York Hospital's medical staff, who will address concerns about COVID-19 and the reasons why reducing the spread of respiratory illness, like flu, is so important this fall and winter. A few quick housekeeping notes before we get started. Our presenters today will share information with you for the first 45 minutes and then take all questions at the end. Unlike traditional Zoom, when you see everybody's faces during the meeting, during this webinar, you will only see the presenters' faces. As participants, your audio has been muted, so if you do have a question, you can type it into the Q&A button located at the bottom of your screen. Please do not use the chat or raise hand icons, as those will not be monitored during this call. If you ask a question through the Q&A feature and it is not answered during this meeting, you can email us at info@yorkhospital.com and we will get you the answer after the call concludes. This webinar is also being recorded and will be available on the York Hospital YouTube channel next week. So again, thank you very much for tuning in today. We'll go ahead and get started and turn the program over to Dr. Jessica Stevens, Director of Emergency Medicine, who will talk about the science behind vaccines and how they help to safeguard public health. Dr. Stevens?
Hi, everyone. Thanks for joining me. As Hillary mentioned, my name is Jessica Stevens, and I'm the Physician Director of Emergency Services at York Hospital. I've been asked to talk about the science behind vaccinations and talk a little bit about how important it is to get vaccinated against the flu in 2020. So any discussion about vaccination starts with the science behind vaccination, starts with the discussion of the science behind immunity. Immunity is the ability of our bodies to resist infection by the action of specific antibodies or sensitized white blood cells. Vaccines work by stimulating our body to produce these antibodies, which are essential to immunity. Flu antibodies prevent effective virus binding and replication inside of our bodies. There's 2 different types of immunity. There's what we call passive immunity and then what we call active immunity. Passive immunity happens when antibodies are passed from mother to infant or artificially in a medical environment when we infuse antibodies, as in the case with rabies exposure or hepatitis exposure. Active immunity is when the body creates antibodies based on exposure to either an active infection or vaccination. Now I'm going to talk about the yearly process of flu vaccine development. The process involves a coordinated effort between public and private entities to produce the most effective vaccine possible based on data from the previous flu season. The Center for Disease Control and the WHO collaborate to review the results of surveillance, laboratory, and clinical studies and look at the availability of virus strains for vaccination production, and make recommendations based on this data as to which strains should be included in the influenza vaccines. The private sector then takes over and vaccine manufacturers isolate the recommended strains. There's different forms of production, but the primary form of production still uses egg, and the virus is actually injected into the egg where it replicates. It's then isolated from the egg, processed to break it up, and isolate the specific antigens, which are the virus proteins, which are going to trigger good antibody production inside our bodies. Those antigens, those proteins, are the basic composition of what makes up the influenza vaccine. The vaccine is introduced into our body. Our body uses its natural immune system to produce these antibodies against the antigens found in the vaccination. And then those antibodies hang out inside of our bodies throughout the whole flu season. And if we're exposed to the flu virus, those antibodies come alive and work to deactivate that virus so that we don't get sick, the virus doesn't replicate in our bodies, and we don't get influenza. Vaccines work to protect both you and also the community around you from developing infection through a process called herd immunity. This image here may look a little busy at first, but if you bear with me, I'll kind of explain it. So there's little people that represent unimmunized but healthy people, immunized and healthy people, and then sick people in the community. And this represents 3 different scenarios. So the first is a scenario where no one is immunized. The second is a scenario where some of the population gets immunized, but insufficient to cause herd immunity. And the third is a situation where most of the population is immunized and protected. So as you can see, in an unimmunized community, 2 infected people will cause an outbreak of disease within the population. In a community where a few people are affected, a few people are vaccinated, these yellow people are vaccinated, these infected people will still infect the majority of the population, and the only ones that are protected are the ones that were immunized themselves. So what we hope is for a population that the majority of people are immunized, and that way the infected people will not be able to cause disease in everyone who is unimmunized. So you can see these 4 unimmunized people in this population, 3 out of 4 of them are protected because everyone around them is vaccinated. So that's called herd immunity. So I'm going to transition to talk a little bit about why flu vaccination is quite so important in 2020, and it all has to do with COVID-19. So this chart right here shows symptoms of COVID-19 and influenza, and what you'll notice if you read through it is there are many overlapping symptoms. They're both viruses, they're both respiratory viruses that cause flu-like illness, including fever, cough, malaise, fatigue, body aches, diarrhea, congestion. So they have a lot of overlapping symptoms. The CDC estimates in the flu season of 2016-2017, there were 2.6 million medical visits that were prevented by flu vaccination and 85,000 hospitalizations that were prevented because of flu vaccinations. In 2020, in the era of COVID, flu vaccination can be helpful for us to protect ourselves individually, but also will hopefully help to prevent overwhelming our healthcare system, and also will keep your body healthy from influenza, so your immune system can be reserved for fighting off other illnesses, including COVID-19, if you happen to become exposed. I'm going to turn it over now to Dr. Michaelvinograd from Pediatrics.
So my name is Dr. Vinograd. I'm an inpatient, outpatient pediatrician here at York Hospital. I am working as the chief of pediatrics with 5 other pediatricians on my team. I'm very proud to be a part of this team. And this picture here is the home team. This is my family. I have my daughter here. Her name is Evie. She's 5 years old and just started at Village Elementary. And then my son Alec is 10 months old, pictured here. And he just recently got his first dose of influenza vaccine. So he's here because he definitely deserves credit to be part of this presentation. So we're here to talk about influenza, and just as Dr. Stevens went through, she discussed the importance of the vaccination and how it can really impact the healthcare system. There's a lot of numbers we're going to throw at you, and we're going to try to impress you with these numbers. And in 2017 and 2018 flu season, vaccination prevented an estimated 7.1 million illnesses, 3.7 million medical visits, and 109,000 hospitalizations, as well as 8,000 deaths. This was in a season where the vaccine was only 62% effective against H1N1, 22% effective against H3N2, and 50% effective against the influenza B viruses. So you can see that even though it may not be as effective against certain strains, the impact that it has on the community's health is very impressive. In 2019, we had 188 fatal cases of influenza in pediatrics. That's children 21 years and under. The idea of why we're having this conversation today is because we want to reduce the complications of influenza and the risk of life-threatening illness. We also want to reduce the impact of respiratory illnesses to the population and the resulting burden on the healthcare system, especially during this COVID pandemic. On that note, since COVID is also a very important topic at the current moment, there is a caveat to that. If a patient or if a person is positive with COVID and having acute symptoms, the idea is to delay the vaccination until the patients are no longer acutely ill. So one of the questions that I get a lot from parents, and even my daughter asked me this recently, why do I have to get the flu vaccine every year? And one of it's very interesting, the science behind it. There are two phenomenons that occur. One is called, that the flu virus actually creates. One of them is called antigenic drift, and the other one is called antigenic shift. Antigenic drift occurs when there are small changes or mutations in the genes of the influenza virus that lead to changes in the surface proteins. The two surface proteins that are present are hemagglutinin and neuraminidase. These surface proteins are what our immune systems recognize as antigens and launch an immune response against and try to block through the production of antibodies. Our flu shots are designed to target the hemagglutinin surface proteins and try to prevent the complications that can occur with influenza. Now, when only small changes occur or only small mutations occur to these surface proteins, the flu viruses are very similar, and thus the antibodies that your immune system creates against one influenza virus can also combat other viruses as well. That's a process called cross-protection. On the other hand, if there are many mutations or the mutations that occur in certain regions of the surface protein that alter the protein to the extent that we don't recognize the hemagglutinin or neuraminidase, that's what causes the severe sickness. And those newer influenza viruses are the main reason why the CDC evaluates the strains of the virus every year and tries to adjust based off of what we have been seeing. Antigenic shift is a little bit different. It only occurs with influenza A, whereas antigenic drift can be either influenza A or influenza B. Antigenic shift, on the other hand, only occurs with influenza A, and it's what causes pandemics. This is what occurs when a shift occurs as a result of animal populations gaining the ability to infect humans. Because we have no protection from these new antigens or these novel viruses, there could be widespread infection with severe complications like we saw with swine flu. There are different types of flu shots, as Dr. Stevens alluded to, with the flu vaccine in the 2020-2021 season, including the standard flu vaccine, which is the inactivated influenza vaccine, as well as high-dose vaccinations that are meant for the patient population of 65 and older. There are certain vaccines that are part of that inactivated influenza vaccine, such as the adjuvant vaccine, which is meant to really stimulate the immune system for patients 65 and older. There are cell-cultured vaccines, as well as recombinant vaccines. Those are the two that are not egg-based, and there are some restrictions in administering them. For example, cell culture is only meant for over 4, and recombinant vaccines are meant for over 18. Live attenuated flu, which most people know as flu mist, is another form of immunization. where there's a weakened live virus that's given by a nasal spray. Most of these vaccines have antibodies that protect against 4 strains of influenza. Influenza A would be the H1N1, H3N2, and influenza B, this year in particular, being the Victoria lineage and the Yamagata lineage. The Victoria lineage influenza virus was the one that caused some trouble for us last season, especially in pediatrics. So, when it comes to children and the flu vaccine, we start to administer this vaccine as early as 6 months of age, and it's meant to be given in 2 separate doses separated by 4 weeks. So any child that is 8 years and under should receive 2 flu vaccines in the same flu season separated by 4 weeks. That even, and as the second bullet point comments on it, that is even recommended if the first dose is given before the child turns 9 years of age. I get a lot of questions very often in the clinic about allergies to eggs. And the literature is very clear that if there's only hives after exposure to eggs, the child should receive any of the licensed vaccinations that are recommended by the CDC. Now, if you have an allergy to a component of the vaccine, but you have never been given a flu shot, it is still recommended to get the same set of vaccines as everybody else, except with the exception that the vaccines should be administered in a setting where there's a healthcare provider able to recognize and manage severe allergic reactions. Now, that's different than the last point over there, where it's if you have been given the flu vaccine and you have a history of a severe allergic reaction to the influenza vaccine itself, then it's a contraindication to continue to get it. This is a very daunting chart for any parent out there. It's a CDC Vaccine Guidelines, and as you can see, based off of these, the amount of vaccines that we're giving starting at 2 months of age, the flu vaccine is right in the middle of that storm, right at 6 months of age. And again, it's separated by 2 doses. So, I understand the trepidation that parents have, but if you put things in perspective, the population that we're trying to protect in pediatrics, there's a lot of there's a lot more to it than the simplicity that I'm about to say. But the population that we're trying to protect are the infants. They have a very high risk of complications from influenza. So there's a rhyme and reason why we start vaccinating as early as 6 months of age. So this is a report card for York County, and this data is as recent as December 31st of 2019. And if you look down here in particular, the flu vaccine compliance is at 65.4% for York County, and 65% for the state of, compared to 65% for the state of Maine, with the goal of trying to get to 70% based off of CDC recommendations. The goal for this upcoming winter flu COVID season is really to continue to encourage appropriate hygienic practices with your children, encourage children to continue what they're learning in the schools, and try to make it fun. There's a lot of different tools out there that any tech-savvy parent can research for themselves, but things like, for example, I've come across something called Soap Pen, where you could actually, it's a type of soap that's in the shape of a Crayola crayon that you could actually draw in different colors on your children's hands and then subsequently wash off. And things like that, can go a long way during these difficult times. Please don't forget to keep up to date on your immunizations and your preventive health care visits, and discuss with your primary care doctors any individualized needs that you and your family have. That's the reason why I am in this practice, is that I'm a preventive healthcare provider, and that's what I would encourage any family, and that's what I do myself for my family as well, to discuss directly with our healthcare professionals. There's some excellent resources that I've listed here. And I'm going to turn over the conversation about influenza during this winter season to Erich Fogg.
Thanks, Dr. Vinograd. My name is Erich Fogg, and I am the Director of Walk-In Services here at York Hospital. And I want to thank both Dr. Vinograd and Dr. Stevens for an outstanding discussion and slide presentation on the science behind vaccinations, the importance of the flu vaccination, why we do it, and the benefits. My job, spend the last few minutes here talking about how do you go about getting one here in the greater York County area. I think we all agree that there is incredible value in getting you and your family vaccinated. So how can you go about and get that done? The great thing here at York Hospital is that we have a whole network of opportunities to get vaccinated. Starting, if you have a primary care appointment, whether it's with your pediatric group, your primary care provider, or any outpatient service, you will be offered a flu shot at those appointments. The only caveat to that is you should not receive vaccination if you're presenting for an illness. So otherwise, you'll be offered a vaccine. If you go to our emergency department for a non-infectious or a non-sick visit, you will be offered a flu vaccine. We also have a network of walk-in clinics throughout York County that include Berwick, Kittery, Stamford, Wells, and here at the York Walk-In. Those offer flu vaccination during all of our business hours. So there's a great resource to get vaccinated 7 days a week. In addition to that, we started something new this year that we've not done before, and we've developed a drive-through vaccine clinic right here at our Route 1 location in York. We offer that service Monday through Thursday, 8 to 4, and on Friday we stay a little bit later and go 8 to 6. So that's another great option. We started that about 3 weeks ago, and we've already given over 1,000 flu vaccines through that drive-through alone. So it's been very popular here in our community. Here's some instructions. If you decide to come through the drive-through stop here at the York Walk-In, there is a flu consent form I'll share on our next slide that it would be great if you could fill out before you get here. It is your consent form. It asks some information about allergies and whatnot, and doing this ahead of time allows quicker throughput through this process. If you haven't had a chance to do that, you'll certainly be given one here that you can fill out while you're in line. When you drive into our location here on Route 1 in York, you'll be met with a volunteer out in the parking lot that will direct you to the appropriate line for flu vaccinations. You get to stay in your car the whole time. That's the great thing about it. You'll roll down your window. You'll be met by one of our caregivers here at York Hospital who will take your information, go over the process with you, and then administer the flu vaccine. Then you will wait a short period of time, make sure you don't have any sort of reaction or have any problems with the vaccination, which would be very, very rare. But we do keep an eye on you for a few minutes, and then you simply drive away. If you happen to come in the off hours that we're not offering the drive-through, certainly you can come inside the York Walk-In and receive a vaccination as well. So very convenient. Here's a copy of that patient influenza vaccine consent form. As you can see, it will really take you less than just a few minutes to fill out. Again, having that done in advance is great, but if not, certainly you'll be given an opportunity to fill that out once you get here. This is a great opportunity to remind everybody that York Hospital is here to serve you for all your healthcare needs during these very interesting times and during this COVID pandemic. There is some concern, I think, that exists in communities that going to a healthcare facility, whether that's a urgent care, a walk-in, an emergency department, or your primary care office, could unnecessarily expose you to any of the infectious disease, including flu or COVID. We take tremendous efforts here at York Hospital to assure safety at all of our locations. So we encourage you, don't delay in making an appointments with your providers or coming to our walk-ins or going to the emergency department, certainly if you need care. As always, your health and well-being remained a priority of ours at York Hospital. We are doing several things at any of our outpatient and inpatient locations to assure your safety. We screen all people coming into any of our buildings. That will include a questionnaire about any symptoms that you may be having. You will also receive a temperature check. We don't do this just for patients. We do that for all of our employees of York Hospital, including our caregivers and staff. We want to make sure the staff is well and safe. We have options to be seen for care that include telehealth. So if there are any reasons for you not to come to any of our locations, we offer another opportunity to be seen through a telehealth platform. We are really serious and maintain our social distancing and maintain those 6-foot recommendations when on any of our campuses. We have the marks on the floor that keep people safely distanced. We have universal masking policies where all of our staff and guests and patients coming into any of our facilities must wear a mask. We also require you to wash your hands upon presentation of any of our facilities. So we have hand cleaning stations as you present to all of our locations. And we have a tremendous housekeeping staff here at York Hospital that works incredibly hard to keep our spaces very clean, including deep cleanings when necessary and daily cleanings, but also between patient visits in all of our rooms, they are cleaned following CDC guidelines and recommendations. So again, come see us. If you need a flu shot, you have many options available. Come see us if you need care. Our emergency department is open 24 hours a day. Our walk-ins are open. Our primary care providers are accepting patients in person or via telehealth. Please stay healthy, get your vaccines, wash your hand, wear your mask, and stay socially distanced. We will now answer your questions. Please use the Q&A icon at the bottom of the screen to submit your questions.
Thank you very much to our presenters. And again, if you have any questions, anybody on the line, you would just use that Q&A icon at the bottom of the screen. You're also welcome to email us at info@yorkhospital.com. We'll make sure that we get an answer to your question personally. Thank you again to everybody on the line and to our presenters. Have a great day.